Dominic Pimenta. He's a hospital doctor, author of Duty of Care, one NHS doctor's story of the COVID-19 crisis. Dominic, thanks for joining us. How are you?
Yes, of course I'm well. Thanks for having me, Anthony.
Yeah, good. No, nice to have you here. We've kind of been talking about the economy and the business side and effect of a lockdown, and perhaps that sometimes we forget the whole reason for it, if that makes sense. You tweeted recently, I think, if people don't want a national lockdown right now, what do people want? What sort of responses did you get?
Yeah, I mean, you sort of seen that shit come out, and I suppose you're sort of hitting the nail on the head, but we've created this almost false dichotomy, really, between virus control and the economy. But if you look at the reality of the situation around the world, the countries that had the highest excess deaths from coronavirus also had the worst hit to their economy. So if you look at us, for example, highest excess death and a GDP hit in the region of 12 to 20%. And if you look at, on the other end of the spectrum, South Korea, which managed very well with heavy testing and good social distancing, and they've only had a GDP hit of 1%. And if you look on a sort of macro level, that kind of makes sense. There's lots of patients, lots of people in society who are at risk from coronavirus. In the UK, it's about 30% have at least one risk factor for severe disease. So if there's a lot of virus in the community, regardless of what you advise people to do, they aren't going to participate in the economy. There'll be many shielded individuals who'll be forced to go to work, and it's disproportionately affecting those who don't have the choice to shield themselves.
I saw an interesting
example, they're back to normal.
There was an interesting, about a month ago now probably, there was a very interesting letter in one of the papers, I think it was the Times from memory, and it was basically, to cut a long story short, it was kind of saying, hey look, at the end of the day we've all got to die of something, we should just add COVID-19 to the list of the things that we will possibly die of at some point. Is that actually more to the point of what is going on here, that ultimately we all got to go sometime, and that the virus does affect, obviously it has an awful effect on some people, but it's just something that perhaps we're going to have to kind of live with.
So unfortunately, we don't have the capacity to live with it in that sense. So again, if you look at the population, about 30% of the population is at risk for severe disease. We're talking about 22 million people who can't, as you say, live with it. We also know that even mild patients who have mild cases in fit and healthy condition, groups that we wouldn't expect any severe disease or need hospital intensive care, a very good proportion, maybe as much as 50 to even 80%, have long-term effects where they do not feel back to normal, chronic fatigue, heart problems, we're seeing an increase in brain problems, kidney problems, autoimmune problems in kids. The truth is we don't know what the long-term effects are, and we've never seen a mass infection event like this, if that's what the proposed is, that we're going to propose the infection 40 million people in the UK if we just cracked on. But the other thing is we have to remember that the NHS has been in a pretty precarious state for about 10 years, running well beyond the fumes of, by every marker before the pandemic hit. Waiting list in A&E, operating list, cancer target, all of that was the worst ever before this ever started. So there's very little capacity to deal with what is essentially an avoidable and preventable disease. And we have to remember that, we may say you have to die of something, but you don't have to die of COVID. Right? Look at New Zealand, look at Singapore. These are places that have controlled their virus, their healthcare system's functioning, their economy's back up on its feet. It is entirely possible to do. The argument that we should give up, I think, is a big underestimation of the fortitude and resilience of the British public. And all we really need is some, coherent public messaging, a single public voice, and back to sort of realigning everybody. Because everything that we do, regardless of what the strategy is, has to be done together. Otherwise, again, it won't work. If we go for a strategy of shielding, instead of the population say, well, I'm not going to do that, it won't work. And all we'll generate is economic damage, and we won't generate any benefits in terms of virus control.
Well, that's a huge issue in itself, isn't it? It's the public listening to the advice and following the advice, and we all know that actually the majority of people will do, what they're told to do and what they're expected to do. But of course, there is that minority, sadly, that don't. They think that it doesn't apply to them.
And I think, the national conversation, at least, the last 3 to 4 weeks, has been very difficult because there's a pretty standard worldwide consensus looking at the ECDC, the CDC in the US, the World Health Organization, saying that virus control is the only way to keep economies going, to keep healthcare from being overwhelmed. And yet we've had this sort of almost opposite narrative in the newspapers and the media in a very prominent, in a very prominent way, from a very small minority of scientists, that generates what appears to be a debate, right, whether there's a consensus or not. But the worldwide consensus is that virus control is the only way to control the virus. There is no case for herd immunity. There's no scientific evidence for it. It's not practical, and it's not ethical either. If you will have to shield 30% of the population, stick them in their homes for an indefinite period of time, but you also don't know who that 30% are. There's lots of undiagnosed conditions, lots of genetic conditions that can predispose you to very severe COVID disease that we now know about. It's not, it's not a practical solution. And again, loads of countries around the world have already done it.
We seem to be reacting rather than anticipating. We're firefighting and not doing the fire prevention work in the first place.
I think that's fair, and I think a lot of the groundwork that we laid during the first lockdown, where people were on the same page and there was that real sense of national solidarity, has been sort of shredded a little bit over the summertime. And in a public pandemic, public opinion is about the only tool that you really have to fight the virus. You rely entirely on people's behaviour. We don't have treatment. We don't have much capacity in healthcare. It's just the trust and transparency of the public. And what we've had is very confusing messaging, lots of U-turns, lots of sort of compromises, like, for example, the 10 p.m. curfew doesn't really have a scientific basis, it doesn't really have an economic basis, it's sort of a halfway house between the two. And what we really need is clear messaging, clear leadership, so that everybody can understand. And if you look at some of so you can track people's mobile phone data, and you can look at some of the lockdown areas in the Northwest, for example, and compare it to where we were in March, and you can see that mobility in March, 80% of people were staying at home and they weren't going to their usual workplaces, and now those numbers are around 20 to 30% reduction. So far less than in comparison, and that's probably why things aren't working, because unfortunately people don't understand the rules, or there's just not that degree of impact. So all we're really doing is causing that sort of long-term economic damage without any benefit, which is why a short, sharp national circuit breaker, which is severe but everybody understands is time limited, is the only real way now to bring the virus back under control, so we don't get overwhelmed hospitals and we also don't sink our economy again over the winter.
Dominic, just while you're on, this news has just broken from Northern Ireland. They've just announced that in Northern Ireland schools are going to close for 4 weeks from next week, and pubs and restaurants will do takeaway or delivery only. What do you make of that?
I think that's a crying shame, but it may be necessary. And the reason I say that is, we had the opportunity over the summer to prioritise what we wanted to get open, have a working track and trade, have some sort of imaginative way to open up schools safely, whether that's for primary schools, more social distancing and bubbling, or alternate day weekly, or online learning for older schools. But instead what we did is we tried to open up everything: pubs, restaurants, offices, everyone goes back to work. And we've got to the point where the prevalence of the virus in the community is now so high that actually we don't have, I think it's John Ash's report, we don't have that many levers to pull. And I don't know anybody, I found myself, I've got 2 kids, we now want to put schools back again. That's going to be disastrous on so many levels. But the problem is, if we don't get control of the virus and it just keeps going up, the risk to everyone, including kids, unfortunately, just goes up and up, and we can't control the virus, and we end up stuck again. So actually, I would say almost that, if we're going to have to pull something severe, we should include schools as well, controversially. But only for a short period limited time, perhaps over half time is a reasonable idea. Yeah. Because the lower virus you can start again with, the more chance you have of fast working time bound, and the longer we can keep it suppressed. And again, I have to say, it does work. You can look around the world, Germany, Singapore, South Korea, they have functioning systems, and they're almost back to normal life.
Dominic, I'm going to leave it there. Only your phone line's breaking up, I'm afraid. And also, I just must say the schools are not going to close for 4 weeks in Northern Ireland. It's 2 weeks. 2 weeks, not 4 weeks. That there's going to be a closure in Northern Ireland. Apologies for that information that was wrong. Ray's in Orpington. You don't agree with another lockdown, do you, Ray?